two, three. Hi, everyone. So welcome you to the Healthy You Conference, Find Health and Life Balance with Qigong and other techniques. This is your host, Master Teresa, and today we want to welcome Dr. Jonathan Fields to the interview, and he is in Florida. So, and then let's read something about him to you. Okay. So today, he's going to talk about acupuncture, scientific, or whether it's BS, right? So Jonathan is the founder of Integrative Medicine US, practicing acupuncture physician and doctor of Oriental medicine. So he's trained with doctors at the legendary Salem Temple. So, and then in the Beijing, the Kulao Hospital, and in the Beijing University of Chinese Medicine. So Jonathan is actually a martial artist, right? So he really loved martial arts. So been practicing it, I would say, all his life, almost like. So he won national awards. So he trained professional fighters. He performed in with celebrities, televisions, and films, and he's also on the board of directors for numerous organizations in China, UK, and US. So he found his way to Chinese medicine, I guess, through martial arts, right? So just welcome you, Jonathan, first.
Thank you, Sifu. It's my pleasure to be here. It's an honor to be part of the event. I think you what you're doing is terrific and giving away all this free education to people. And it's just very pleased to be able to participate with all these great speakers that you put together.
So you are a great speaker too. Thank you so much. And then we have much to learn from you today. So I know you martial artist, and then you really enjoy going to the Salem Temple. I saw you practicing there with the monks and etc. So and now you become a Chinese medicinal doctor, right? It must be difficult, right, to wear that uniform. Maybe you should be like this, right?
It is, but that's how I found my way into Chinese medicine. I've been, like you said, I've been in martial arts my whole life. And as you get a little older and you start accruing some injuries from all the martial arts training, and as you learn how to put your ego down and learn how to bring other people up, you look at what can I do besides just learning how to hurt people, and you want to use those same abilities to be able to heal people as well. And a true martial artist, and as you learn, get closer to a level of mastery and excel in your field, you should be able to do both. It's all how you use your intentions.
It's just really amazing. So it must be a lot of struggles to figure out what you actually want to do. To wear that white uniform now. It must be a long journey, right?
It has been a long journey, and I had been interning and basically studying with a Chinese medicine doctor for a long time. Introduced me to Qigong and Chinese medicine, Dr. George Love, and for many years I was very interested in the acupuncture, but I just wasn't ready to make that move and get into it. And it was really after I had my own personal struggles with health and adversity that kind of brought me around to it. About 7-8 years ago, I had a health meltdown. I started having hot flashes and chills, and I had tendonitis and carpal tunnel and depression and fatigue and all these different symptoms.
Wow.
I was only 32 years old at that time. And it seemed like I was going through menopause or something.
Really? Wow.
It was really, really bad. I mean, I had to take a year off.
That's horrifying, I think.
It really was. And the more horrifying part is that I could not get any help from Western medical doctors.
Oh.
I spent a whole year going to doctors. I went to neurologists and endocrinologists and specialists and hand surgeons and all these things. All my blood work was perfect. They all say there's nothing wrong with me, and it's all in my head, and they gave me muscle relaxers and painkillers. I knew that wasn't going to solve any problems, so I never took them.
So what you're saying that, so in the eyes of the medical report, you're good.
Yeah, except I felt like
you felt terrible.
I felt like I had cancer or AIDS. I was sure I was dying. I was miserable. I had been healthy my entire life up to that. I guess I was about 32 at the time. Never had any health issues except for minor injuries. And all of a sudden, just everything was wrong. I mean, my hands were ice cold. I was sleeping 12 hours a day. I'd get up out of bed, be fatigued right away, go back to bed. My back pain was so bad I couldn't even sit in a chair. My
Yes.
carpal tunnel was so bad I couldn't even touch a computer anymore. I couldn't work.
Wow.
Yeah, so that after a year of going to all these doctors and not being able to get any help, and then making me feel like I was crazy, the system just completely failed me. I went to see a nutritionist friend of mine, and he ended up figuring out Reed Eckert. I work with him in a vitamin shop. We have a practice together now in Tamarack, Florida, and we do nutritional counseling there for people, vitamins and supplements. And I have a room in the back where I do acupuncture and Chinese herbs. But he figured out my problem was an iodine deficiency, and he gave me iodine that was made from seaweed. He gave me some vitamins and some supplements. I didn't think it was going to work. I thought, I already went to all these doctors. They couldn't figure out, how's this guy going to figure it out. Within 2 weeks, most of my symptoms were gone. No more chills, no more hot flashes, no more depression, no more fatigue. It was a miracle. It took me a while to get my body back into shape, though, because, I had the back pain and the carpal tunnel. He put me in touch with a chiropractor who helped me tremendously, and I was getting acupuncture on and off with my doctor as well. And I got better. And after going through all that and having to live through it, I realized, the most noble thing for me to do now after being humbled by disease is to help other people with these unsolvable diseases. As you know, I mean, sometimes it's like magic what you can do with Qigong or Chinese medicine or any alternative medicine.
Wow. So I know you said the symptoms gone very quickly, but how long did you actually recover, right? Although you felt better, right?
Well, it took about a couple weeks for the hot flashes, the chills, the depression, and the fatigue to go away. But for me to get my tendonitis and carpal tunnel and get rid of the back pain and all that, working with a chiropractor and an acupuncturist, it probably took a good 6 to 8 months until I was mostly recovered. And then it was still like another few months after that when after I had enrolled into Chinese medicine school, where I was getting consistent treatments 2 days a week. I'd say I was about 80% better within about 8 months.
Yes.
But once I got into Chinese medicine school and I was getting treatments twice a week, and I started with Chinese herbs, it was like that. The rest of I went right back up to, because healing is in plateaus, it's in stages. It's not always, everybody wants to heal like this, but we do a little bit up and down. But as long as it's 2 steps forward and 1 back, you're still 1 step ahead. But about a year, I would say, to make a full recovery.
Yeah. So this is good. Like the journey is good too, because it's not about you anymore, because you're already good. Become a doctor, heal people, and give herbs, do acupuncture. But the thing is, for other people to listen is very interesting, because they know, they were sick and they were hopeless. And then when we started to do something, they felt something good for a couple of weeks, and then it continued to improve. So it's really a few months, but then it's not finished. And then you have to hang on to continue to do. I know healing is just like a lifetime to me, but it's so much, really, so much physically, and then go to emotionally.
It's your lifestyle.
Yeah, so beautiful. So
you have to change sometimes.
Many things, yeah. So I'd like to ask you today, your topic, you want to talk about acupuncture. Is it scientific or not, right? So this is a beautiful topic indeed. So I'd love to listen more to you. How would you, tell the people that not very used to thinking of the needle on the body or something, and then how it connects with the Chinese medicine, the herbs, right? They actually work side by side, and then how it connects with the the Western supplements, and so it's very interesting how it works together. I've been doing all these things. Really nice to listen from you, right? Professionally trained.
Yeah, absolutely. So, like you said, you have experience with this stuff. I know some of the people listening might not, so we're here to explain it. Is acupuncture real? Is it placebo? It's a very controversial topic. especially in this country, a lot of us have heard about acupuncture. Maybe we know somebody who had acupuncture, but a lot of us have, may not be familiar with it or don't know how it works or why it works. So I'll make this very clear, nice and simple. It definitely works. Yeah. It's incredible. It's miraculous. It works just as good as any other type of therapy. Just as good as chiropractic or physical therapy. Yes.
John, sorry. So just now I did not press the record button.
Oh, okay.
Okay. So it's all good. So is that and that's it, right? So but we recording now? It's on Facebook. Like Facebook always has a recording. Everyone's listening, but I actually like it to get it recorded again. So I just know that the the signal is not as clear also online. So we'll see, but it doesn't matter. I just want you to know that's it. So to recap this, like maybe you can explain what is acupuncture so people understand a bit step by step, maybe nice. What is acupuncture?
Sure. What is acupuncture? So acupuncture, I guess, is the art and science of using, these days, it's very tiny, small, filiform needles. They're a hair thin. They're not like injection needles. They're maybe a tenth of the size of an injection needle. And we put them into certain points on the body along the Chinese meridians. And we use them basically to move blood, move qi, to tonify and nourish certain deficiencies, and also to drain or reduce different excess within the channels, the organs, or the emotions within the body. Do you want me to get into the way it works or why it works? Or?
Well, I mean, why it works is nice.
Okay, fantastic. So why it works is, I'll give you from a Chinese medicine standpoint, we're looking at basically moving blood and moving qi. Now, a lot of people, I think in the Western culture, they hear the word qi and they think it's some kind of superstitious, mystical thing that doesn't exist because they can't relate with the concept, having not felt it or been a practitioner or not grown up in a society or a culture that kind of explains it. And just to simplify it, we're going to label it for now. It's much more complicated than this, but let's just say energy, right? People want to say energy. Not confusing, nothing mystical about it. Our body's full of energy. We have thermal energy. We have electrical energy, right? Our nervous system is electrical signals going back and forth. Our body is warm. It's 98.6 degrees. So that's thermal energy. There's all sorts. We have chemical energy, all sorts of chemical processes happening in the body, metabolism, hormones. Everything runs on energy, right? The universe, we're electrons. That's what we're made out of. So it's very scientific, and it makes perfect sense. Do we know exactly the process of how it works for certain things? No, but we do know it works because there's thousands of years of recorded history that's been tested on arguably the largest population on Earth. There's a case study of billions and billions of people, and it's still around, and we know it's effective. Now, it's very different from how it used to be practiced. In ancient days, they had, 9, 10, they had a whole bunch of different acupuncture tools. Some of those needles were not really needles. They were more like surgical instruments. They were big, blunt things. They were arrowheads. Today, we just use very tiny little needles so it doesn't cause the patient a lot of pain, and we can get the most amount of done with the least amount of impact, or the least invasive as can be.
So, yes. Do they feel anything when the needle goes in?
Yeah, absolutely. That's a good question. So everybody's different. Most people do not have a problem with it. I found that probably 99% of patients are very receptive and have no problem.
Yeah.
Every now and then you'll have somebody who's just overly sensitive. People who we consider to be excess are usually a bit more sensitive to a needle, and people who we consider deficient usually have no problems with it. One of the easy tests that I do for somebody when a patient comes in and asks if it hurts, I poke them in the arm, in the shoulder. If they say, ow, I say, okay, you're going to be a very sensitive case to deal with. Anybody else? If not, not so much. Certain points on the body are more sensitive. Yeung, right, on the bottom of the foot, the kidney 1, the bubbling spring, very sensitive point. Most of the points on the body are not as sensitive. The feet tend to be kind of sensitive. Rest of the body is not so much. Generally, you'll feel a little pinprick when it goes in, almost like an injection or something, except much, much smaller needle. So it's less, and then it kind of goes away. You may have sensations once the needle is in, though. That's the fun part. You might get the feeling of qi as we're inserting the needle.
Exactly.
We're looking to get the qi, which means that the body should kind of grab the needle, is what we're looking for. And while it's in there, you might feel pressure, you might feel tingling, you might feel electrical signals running up and down the arm. Everybody experiences it differently in different locations.
Well, I will look at that as a good sign because something is happening instead of nothing's happening. So you're going for something, right? So
absolutely correct, Sifu. And sometimes people their first time, sometimes they're a little nervous and they start feeling the tingling and they say, "What's going on?" Yeah. But we have to be very patient, and patient education is very important as well. So I tell them before we do the procedure that you might feel things moving around, you might feel some pressure. It's perfectly normal. And then after you put the needles in, you spend a couple minutes with them, just make sure they're okay and they're comfortable. And then, after they're all set up and ready and they're feeling fine, then I can turn the lights off.
That's no big deal. It's so simple. There's a tiny, I really don't actually feel anything at all. So I will ask you, what kind of problems are the usual things that you see often helped by acupuncture?
So that's a great question too. And that's another one of the areas we have a lot of misconception, I think, in the West, because people look at acupuncture as just for treating pain. And it's true. I would say probably, I don't know, maybe 60, 70% of what I do is treat pain, back pain, neck pain, carpal tunnel, tendonitis, arthritis, runner's knees, plantar fasciitis, all sorts of things like this. We do treat all that. But what a lot of people don't know, especially with acupuncturists who practice herbal medicine as well, is that we do primary care and internal medicine. We treat colds, we treat flus, we treat a lot of GI issues. I have tremendous success with people with digestive issues. Fertility is a big thing we treat. We do tremendous work with anxiety, depression, addiction, weight loss. And we have different protocols.
Addiction?
Yes.
Wow. I want to know more of that. That's not an area I don't know too much how acupuncture works on it too.
So there is an auricular acupuncture method. The Chinese always had auricular points for the ear. Mm-hmm. But there's an auricular method that was actually developed by a French doctor in the 50s, David Nogier, who's very famous for it, and it's practiced all around the world. The Chinese actually adopted some of his system into their current auricular system. Yes. But there's a protocol of about 5 points in the ear that have to do with different organs and different functions of the brain. And we use this. There's a protocol called NADA, and they use it in rehab centers and clinics all around the country. If you ask people in the industry, it's very well known to people in the like the drug rehab industry. If you ask about acupuncture, they'll tell you right away, yeah, they do it in the ear. And for weight loss, this similar thing, and for quitting smoking.
I saw people left something in the ear sometime, right? A little acupuncture, maybe a little metal or something.
Yeah, so right now they use the magnets. Traditionally, it was Vicaria seeds. It's a Chinese herb. And what they do is they put a little sticker on it, right? Yeah. And they stick them in the ear over these points. Yeah. So when you go home with the sticker, it kind of keeps the treatment going for a few days. The stickers will sometimes stay on 3, 4, 5 days. And what the patient can do is you tell them, hey, if you're feeling stressed out, you press on it, you squeeze it, and it hurts because it's actually like a little metal ball or a little seed pressing into your ear. And when you start applying pressure to it, it reactivates the treatment. And then sometimes you do just with magnets. Some people have a magnet.
I know people trying to quit cigarette, trying to do acupuncture at the ears too.
Right. And they have electric stimulation that they do to it and all sorts of things like that.
Yeah. You have success with that?
Yes, but that is a great question. We do, but I always tell people up front, I say, listen, we're here to help you. I'm not here to take it.
But we don't want to guarantee.
You're not 100% committed. Yeah. If you don't want to quit, if your wife wants you to quit, forget it. If you want to quit, we can help you.
I have people told me after they stimulated acupuncture, they find when they smoke, it doesn't taste good anymore. Is that what it is?
So what happens is with any acupoint, one of the side effects, and this is where it gets scientific, and they've measured this and they've done
Yeah.
blood studies and functional MRIs and all sorts of things at Harvard and
Yeah.
MIT and Johns Hopkins and UCLA. They found that acupuncture releases endorphins in the body. So with cigarettes, a lot of it is the addiction, right? And when you need your fix, when you have your addiction problem, what's going on is that you need you're short on your endorphins, serotonin, dopamine, feel good hormones. So the acupuncture releases endorphins. So if you get that fix of the endorphins and you're already feeling good, then you don't necessarily need the cigarette or to keep eating to make yourself feel good or to do some kind of other addictive or destructive behavior because you're already getting those hormones that kind of take you out of depression. And now they find a lot of those same hormones are involved in diseases like deficiencies of them, like Alzheimer's and dementia and things like that. So I'm not making the correlation that it cures Alzheimer's and dementia, but we know that without these hormones, you have a serious problem and you're open to these diseases. And that acupuncture and acupressure and these different types of methods can help stimulate the production of these hormones.
No, it's just wonderful. I guess knowledge is really just amazing, right? All those things coming together, and then to have you in Florida to show people with a lifetime of experience in Kung Fu martial arts too, and have your own, I guess, difficult times too, right? Which you never have to experience difficult times anymore.
And I think it's one of those things you got to try to believe it. I would say probably 60 to, no, probably more. I would say probably between, it depends on the case and what you're treating, but probably 60 to 80% of my patients do get better. Pain is one of the easier things to treat. You know, complicated internal stuff is a little more difficult. But I think our results are probably
just need some time.
Better than medications or physical therapy and things like that. And for me, when I started with Qigong, you could feel it. You could feel, not the first day maybe, but after you start a regular practice, you start feeling the changes in your body. You can feel the changes.
Well, it's nice to, to teach people Qigong and they also have acupuncture or, a combination is always nice, and that's really wonderful. So is that something that is very important we should mention to the people today?
Yeah, absolutely. I would say the most important thing is, one, never give up and don't be discouraged. If the doctors tell you there's no cure for your condition, if they tell you there's nothing wrong with you, if you know something is wrong, don't let their very limited scope of knowledge have an effect on you, because there is a placebo. Yes. Placebo is real, whether it's negative or positive or acupuncture or medications or surgery. There's still a placebo effect on everything. So when someone tells you it's not possible for you to heal, a lot of people get very depressed and they get much worse after that. So just never give up. And if one acupuncturist doesn't work for you, or if one chiropractor doesn't work for you, or if one Qigong master is not good for you, try another one. And they're not all the same. The systems are different, and just do not give up on yourself, I think, is the most important thing. And the other thing is to have balance in life. Emotional balance, I think, is one of the hard things that we don't talk about in this country, and we neglect. And in this, but in Chinese medicine, the root of all internal disease generally comes from spiritual or emotional issues in the life. So I think people need to be more aware of what's going on with their emotions and kind of learning how to get them moving so they don't have stagnation in the body. Because stagnation, right, stagnates your qi. So exercise, I guess, would be the other important thing, right? Because Qigong and Tai Chi, right, exactly, is built into the Chinese medicine. And I do actually, I do, when I treat patients, if they come in for back pain, I give them Qigong exercises. So I tell them, you don't expect me to fix every problem you've ever had in your life. It's a team, right? We got to work together.
Yeah, so true. So really beautifully said. So if people wants to experience you, set up appointment, your website is integrativemedicine.us, right?
Exactly. Yeah, that's integrativemedicine.us. They could find more info there. So it's not .com, .us. I have a vanity name though too. It's imedicineus.com, if that's easier for some people to find.
Yeah. So which part of Florida are you in, right?
I'm in the South Florida on the East Coast and near Fort Lauderdale. I'm kind of in between Boca Raton and Fort Lauderdale, a little bit west, like maybe about 20 minutes from Boca and 20 minutes from Fort Lauderdale, kind of right in the middle.
Yeah.
So it's nice. We're situated Broward County, so we're in between Miami and West Palm Beach.
Yes.
Very
Well,
nice.
just for a matter of interest, are you giving Kung Fu class too? Because you are very strong in the Wing Chun Kun, right? And the
I
Mongkok
am.
Kun too.
So yeah, so I teach a style of Jumbo Wing Chun. It's actually a UK-based Ip Man lineage, but we teach other styles of Kung Fu as well. Shaolin, Meiwa Chuan, Plum
Yeah,
Blossom, Kung Fu, which is very internal as well. I
yeah,
teach in Lauderhill, our school. I've been with the same school now for 14 years under my master, John Legrand.
yeah.
Lost Legacy Systems is the name of our school, and if anybody wants to look that up, it's
Yeah.
lostlegacysystems.com. We have classes going on 3 days a week currently, so they could come train with us as well, where we teach a bunch of different Chinese martial arts. And whenever I teach, I always start off the classes with Qigong and Tai Chi.
Yeah. Uh,
Always.
is it okay for people to Facebook Messenger you? Is that something you will check sometimes?
Yes, please. I'd be happy to help. We're here to help as many people as we can. We're always open to connecting with other good people, other like-minded folks. So if it's something, if we need to make a referral to somebody or just a simple question, I'm always happy to hear from anybody. My Facebook handle is at Jonathan M. Fields. That's Jonathan, M as in Mary, Fields. Well, M as in Matthew, but Fields.
Okay, wonderful. So thank you very much for joining me today. And thank you, audience. And then we'll see you again in another episode. So we have like another week or so to finish the conference. Okay, so thank you,
Fantastic.
Jonathan.
Thank you, everybody on Facebook. Seafood, thank you so much for having me.
Oh, you're welcome. So thank you.
Be in touch.
Uh,
Okay.
uh,
And good luck with the rest of the conference.
Thank you. Well, I'm gonna actually call you again, actually. Okay,
Okay.
bye.
Okay, Sajan. Bye.
Okay.